Heart disease causes some 1.2 million heart attacks every year. There's several risk factors for heart disease. Some are controllable, others are not. Dr. Jeffrey Stein of Boca Raton Regional Hospital joins us to break them down for us. Thank you so much for joining us. First of all, Doctor. Heart disease, one of the leading causes of death in the United States. Why do you think that's so prevalent, heart disease in the United States?
I think it's so prevalent in the United States because it seems that the diet in this country is not as good as it can be. Lack of exercise, obesity, childhood obesity tends to increase the risk factors for that.
You know, it is, like you said, often linked to overweight and obesity. Are there any other causes that maybe don't jump out at the regular person? That smoking, perhaps one of them. Anything that else that jumps out at you is other than wrong foods to eat?
I think there are a huge component of family history is very, very strong as far as the risk factors are concerned. There are patients that I have who lead a healthy lifestyle, exercise, eat the right foods, don't smoke, and yet they'll wind up with coronary artery disease purely because mom and dad had it. So,
you know, if somebody's hearing this out there, they're like, okay, doom and gloom, gosh, my grandpa, my grandma, my mom, my dad, what can they do to at least give themselves the best shot not to have heart disease?
I think reducing the risk factors, getting their cholesterol checked, continually exercising, eating the right foods, not smoking, is their best chance of reducing risk, the risk factors.
Sure. Is there any difference when it comes to heart disease in men and women, any differentiation?
Used to be that men were the leading cause of heart disease, and it seems that there's a trend for women catching up. So right now, maintaining reducing the risk factors, I said before, is your best bet for not developing coronary disease.
Once you know you have a heart condition, is there any that stand out? Heart disease is a pretty broad term, but is there any specific names for a heart disease that you can name or that people should be familiar with?
I think just knowing basically the term of coronary artery disease, atherosclerotic heart disease, they're all basically the same. They describe, diseases within the coronary arteries themselves. The nomenclature to describe it really isn't as important as knowing how to prevent it.
Following under the umbrella of heart disease.
Correct.
Here's how you prevent it. Okay, before we go, one thing you could tell people to prevent heart disease, even if they have it in their genes, just one bit of advice you could give them.
Best advice, yearly office visits with your doctor, exercise, eat healthy, and just make sure you follow those above recommendations, and that's the best you can do.
Sounds so simple, but boy, it can help a lot, can't it?
It sure can.
All right, Dr. Stein, keeping you healthy here in Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.